Let's go over how you would provide open circuit suctioning for a mechanically ventilated patient with a tracheostomy. Please refer to the MUHC protocol for detailed information on when to perform suctioning and the rationale behind steps in the procedure. You can find the protocols in the Policies and Procedures section on the intranet. Search under T for tracheostomy. You may also wish to view the tracheostomy daily care video on the MUHC Nursing YouTube channel. This demonstration video is divided into 3 sections: preparation and materials, demonstration, and wrapping up. You will need a blue pad, clean towel or non-sterile drape, a suction kit, and a bottle of normal saline. Ensure wall suction is properly set up. The wall suction tubing is attached to a canister and not directly to the suction regulator. Note that wall suctioning equipment should always be set up and ready in case of an emergency. Turn on the suction to between 80 to 120 millimeters of mercury. Explain the procedure to the patient. Wipe down the table. Lay out your equipment. Wash your hands and don your personal protective equipment: procedure mask, face shield, and non-sterile gloves. Do a respiratory assessment including lung auscultation, oxygen saturation, and respiratory rate. Position the patient in a semi-Fowler's position. If the patient is able, ask the patient to cough to help mobilize the secretions. Some patients benefit from supplemental oxygen prior to suctioning to help them tolerate the procedure. If needed, press the 100% oxygen button on the ventilator and wait for 5 breaths. Place the blue pad, clean towel, or non-sterile drape over the patient's chest. Gently open your suction catheter package, being careful to maintain sterility. Take out the sterile pop-up cup and pour normal saline. Apply the sterile gloves over your clean gloves. Remove the suction catheter from the sterile package. Place the catheter in your dominant hand. This hand will remain sterile. Note that there is still a protective sheath on the sterile catheter. Use your non-dominant hand to grasp the non-sterile suction tubing. Attach the suction tubing to the suction catheter. Slide the catheter out from the protective package and grasp the suction catheter 6 centimeters from the end of the catheter. Place the tip of the suction catheter into normal saline. Test the suction by pressing on the port with your non-sterile, non-dominant hand. Press the temporary alarm silence button on the ventilator. Do not place the ventilator on standby or turn the alarm off. Use your non-dominant hand to disconnect the patient from the mechanical ventilator. Place the ventilator tubing over your clean drape, facing away from the patient's face. Perform shallow or deep suctioning depending on the patient's needs. Shallow suctioning is preferred when the patient is able to cough the secretions to the opening of the tracheostomy tube or the secretions are visible. Perform deep suctioning if the patient is unable to mobilize their own secretions. To perform shallow suctioning, insert the catheter just into the opening of the tracheostomy tube. Ask the patient to cough. While the patient is coughing, place your thumb of your non-dominant hand on the suction port in order to apply continuous suction. To perform deep suctioning, insert the suction catheter gently until resistance is met or until the patient coughs. Withdraw the catheter about 1 centimeter. Then apply suction continuously while withdrawing the catheter slowly in a circular motion. This step should not take more than 10 seconds. If you need to suction again, reconnect the ventilator using your non-sterile hand and wait 4 to 5 breaths in order to give the patient a break before repeating the technique. Rinse the suction catheter by dipping the tip of the catheter in saline and applying suction between suction attempts. After secretions have been cleared, reconnect the patient to the mechanical ventilator. The ventilation will automatically resume. Throw out contaminated material. Remove your gloves, wash your hands, take off your visor, and wash your hands again. And put on a pair of non-sterile gloves. Perform a respiratory assessment. Before exiting the room, make sure the patient is comfortable, the alarms on the ventilator are functioning, and the environment is safe. Restock any items that you used in the room. Document the procedure and your observations, including the amount, thickness, and color of secretions, according to your unit practice. Communicate any concerns with the registered nurse taking care of the patient.